If you go to a clinic, a stem cell clinic now in the US for stem cell therapy, they're going to do one of three things. They're either going to use allogeneic stem cells, which are cadaver cells that are frozen, and then they thaw them, put them in some gamish, and then inject them into a joint. So you can imagine the biologic activity of those cells is very limited. And who knows what, contaminants are in that. So
Right.
we don't, advocate that. And the FDA is actually taking a pretty hard stance on trying to crack down on the use of cells for that. It's called a non um, autologous use application. So basically, if you're going to use stem cells, they need to come from the same tissue and
Yeah.
have the same application they would in your normal like biology, and that's not what a lot of these are being used for. Or they're going to take fat from your abdomen via liposuction and try to isolate stem cells from that, or bone marrow. And those are both pretty invasive procedures,
Yes.
and uh, they have no regenerative capacity. So those things will not make new cartilage or bone or ligament. They just act as anti-inflammatory units, and they're pretty good at that. So they
Right.
will help with pain. They're not going to grow anything
And
back.
for how invasive it is,
Oh my
that's
goodness,
yeah.
yeah, and then for the cost,
Yeah. Oh, yeah.
they tens of thousands of dollars. So, that's where the real ethical breach is from my perspective, is that to charge that much for something that has no proven efficacy to regenerate any cartilage, but to even intimate to the patient that it might, is a little bit disingenuous, and it contaminates the work that we're doing, because we're really trying to push stem cell science forward.
Right.
And meanwhile, the FDA is cracking down on all these different clinics because they're using it in an unethical way.
Right.
So, a lot of what I do when patients come in to talk to me about stem cell therapy is unwind everything that they've heard about this from their friends who had anecdotal success from having some stem cell injection done
Because
at a
their
clinic
friend said
on
it
what.
was good or
Yeah,
yeah.
exactly.
Yes.
So, I don't disparage the folks that are doing it,
Right.
but I do give a lot of education about what to really expect from it. And I do tell them there is a beneficial effect. It is an anti-inflammatory, and if you're going to compare it to, say, steroid, it's probably better than that for sure, because it doesn't have the same catabolic effects, negative effects that steroids do on tissues. But I'd be a lot more enthusiastic about it if it was less expensive, and approved by the FDA, and that hurdle is gonna be very hard to come over.
And even a protocol behind, preventative not preventative, but preventative maintenance basically, because you can't if you're just providing, an anti-inflammatory, you're not fixing the actual problem, so whatever was causing the issue in the first place, you're gonna have to address that. So I feel
Right.
like in those situations, most of the time, people just address the stem cell issue and then that's it. They don't really go into the
Mhm.
longevity point of it. But I think there needs to be education around that too, because you're
Right.
not just like injecting muscle, you know?
Mhm. Yeah.